Mhm. That's great, Jesse. Thank you. Yeah, and we are about ready to get started now. So I want to welcome everybody to our Community Health in Your Business's Bottom Line session. I'm Joanne Siccato, and I'll be your moderator today. I am the Community Engagement Coordinator for Lake and Mendocino Counties for the NorCal for Health project. And we're going to be joined by our speakers today, Amber Weir, who is our project director for NorCal for Health and works in the Del Norte and Humboldt County. And then Tina Yuen, who is a senior planner at ChangeLab Solutions, where she works at the intersection of planning and public health and supports cross-sector collaboration and policy systems and environmental change. So I just want to welcome everybody. Welcome everybody to the space, and I hope that the event is going well for you. I'm just going to do a few housekeeping reminders before I hand it over to Amber. It's best if you can expand your screen to the full size. If you have that bandwidth, you'll be able to see the slides better, and that is with the little screen square down in the bottom right-hand corner of your screen. So you can flip back and forth from that. If it turns out that your bandwidth makes it a little bit sketchy, you can always reduce that back down. We'll be taking questions you can either use the chat or you can go to the Q&A, which is under the session part of the chat area, and you can put your questions there. We'll be taking questions after the presentations. We'll also be offering you a survey to fill out about this session. And for this session, you're going to receive a $30 value of a New York Times bestseller book titled Upstream: The Quest to Solve Problems Before They Happen by a New York Times bestselling author, Dan Heath. And so we thank you for joining the session. And Amber will be putting that link for the survey in the chat for you. And that's something you can do before you leave the space, which we hope will be after our presentations and the Q&A. If it turns out that you have difficulty in the space, you can try refreshing your screen through your browser, or you can choose to click the leave button and then re-enter the space. And sometimes that can take care of any of the little glitches that can possibly happen. So we will do our best as we get started to mute you upon entry, but if that's something that you can do for yourself, that would be greatly appreciated. And then when we get into the Q&A part of the event, we'll ask you maybe to share your audio, share your video, so that we can hear your questions directly. But again, feel free to put those in the chat and or the Q&A session. And the leaving part, if you do leave, that just shuts off your video and audio, but you can still listen to the event from there. So I am just noticing that I can't see Amber at this moment, and I'm just wondering if that's something on my end. And if Tina, can you see Amber?
I think she dropped out. I don't see her either.
Okay. So
let me try to log back in.
Yeah. So
I'm back.
Here.
Oh, there you are.
I'm sorry.
Okay. New technology space.
When I tried to click the link for everyone to copy and paste into the chat, I ended up getting bounced completely
of
Google. So if you can do that.
Yes.
In the meantime, let me get my presentation up and ready. I apologize.
That's okay.
It wouldn't be an online Zoom or an online platform experience without these technical difficulties.
Yes. Welcome to the hop-in sphere. So,
yeah.
And with that, again, thank you for coming. And I'm going to hand it over to Amber now, and she'll go ahead and get started with her presentation.
All right. So let me make sure this is sharing correctly. And Get my notes up. All right. Well, good morning, everyone, and thank you for attending Community Health and Your Business's Bottom Line. So as Joanne probably already mentioned, my name is Amber Weir. I am the project director of NorCal for Health, which is a project of the California Health Collaborative. We are a not-for-profit committed to enhancing the quality of life and health of the people of California. The NorCal for Health is a new project. We work in a 4-county region of Del Norte, Humboldt, Mendocino, and Lake. And one of our project's goals is to raise community awareness around creating local solutions that make the healthy choice the easy choice. So historically, these health conversations and figuring out how to address community health have really been left up to local government agencies like public health and the planning departments, and as well as some health organizations. But I'm here today to tell you why our business community, our community leaders and influencers need to take an active role in these conversations. So I'm going to do that by introducing you to the U.S. health disadvantage and how that actually affects our economy and our businesses' profits, as well as our people. We will hear from local voices, and then we'll end with how we can make lasting changes that will elevate both community health and our local economies. So let's begin with this short video explaining the U.S. health disadvantage.
Did you know that Americans are less healthy?
Oops, did it stop? Here we go.
Have shorter lives, and pay more for health care than people in most other wealthy nations? Collectively, this is known as the U.S. health disadvantage. Most of us, including many U.S. workers, have chronic conditions like diabetes, hypertension, and obesity. 6 of 10 adults have at least one chronic condition, and 4 of 10 adults have 2 or more chronic conditions. The U.S. health disadvantage is growing, and it has major implications for businesses and employers. Businesses depend on healthy workers, suppliers, and consumers, who in turn depend on 7 vital conditions in order to thrive. Basic needs for health and safety, meaningful work, humane housing, reliable transportation, lifelong learning, a thriving natural world, and belonging and civic muscle. Businesses and communities must work together to ensure everyone has access to these vital conditions, because healthy communities don't just lead to healthy citizens, they lead to a healthy bottom line. Find out more by reading Community Health and Economic Prosperity, engaging businesses as stewards and stakeholders at hhs.gov/surgeon-general/reports-and-publications. Did you know that?
All right.
Did you know that Americans are less healthy?
Oh my goodness. Let's see.
Did you know that Americans are less healthy?
There, I think we got it. Paused. Sorry about that. So what I was hoping was that this video would help you make the connection between community health and business success and how they're closely related. Companies depend on communities to provide healthy employees, consumers, and business partners, while communities depend on companies to offer jobs, stability, and opportunities to create wealth. So recognizing that interdependency between the two sectors really encourages collaboration between the two, and both must thrive for either to be strong. So what I wanted to then do is kind of narrow it down to the business level and the actual costs. If you're a business owner or a manager, you know that employee expenses are your number one cost, the salaries, health insurance, and benefits. Many of our small businesses can't even afford to offer health insurance because the health rates are so high. And what drives up these rates? Poor health. The poorer the health of the community or our people, the higher our rates are. And the higher our disability rates are. And the more absences for illness and medical appointments. And presenteeism, which is working while being sick, or in many cases, going to work with symptoms of withdrawal from substance use. Employee turnover. Now, this is one that I heard a lot. I used to be a small business advisor for the SBDC. And when working with businesses, they were always saying how hard it was to find good workers or employees, and that they constantly were trying to or having to rehire and train. And that was really difficult for them. The time it took to retrain each of those employees also took away their time from productivity, which ultimately led to reduced consumer spending. If your business is wasting time over and over again with employee issues and turnover, the business is not able to be its best. It's not able to compete at its optimal rates. It's not as innovative or competitive as it could have been. So we know that the financial impact for employers continues to grow. A study conducted by the Integrated Benefits Institute shows the cost of poor health in the workplace, which includes the absenteeism, disability, presenteeism, all of the things that we just went over, on average are costing businesses more and more every year. So in this sheet or graph, you see in 2019, the average cost of poor health per employee to a business was $3,918. And for every dollar spent on healthcare benefits, another 61 cents is spent on illness-related absences, disability, and reduced work output. So now this is the average across all employees, all people. But let's zero down yet again. What if we have an employee like a smoker? Well, we see that in this study published by the National Library of Medicine, it shows that employees who smoke impose significant excess costs on private employers. The annual excess cost of one smoking employee to a business is roughly $6,000. The study found that employees that smoked had higher rates of absenteeism, which equated to roughly $500 a year. They had reduced work output, the presenteeism, which, the presenteeism, which costs the business roughly $460 a year. The study also found employees that smoked took more unauthorized breaks than their non-smoking peers. So that actually cost a business roughly $3,000 a year. And then there is, of course, the healthcare costs averaging $2,000 more a year. Now, we all know that when you smoke, it lowers your immune system, and many smokers suffer from chronic illnesses such as COPD and heart disease. Now, I'm not sharing this information with you to say don't hire people that smoke, but rather let's change the social norm around smoking and nicotine use. Currently, our youth are getting addicted to nicotine through vaping at alarming rates. Nicotine, when used as a youth, impacts and actually changes the receptors in that youth's brain and offers long-lasting effects for the next generation of our children and of the workforce and people that you'll be hiring. So where we were making great progress with adult smoking rates going down, only now we're kind of going backwards with youth that are addicted to nicotine before they're even legally able to be purchasing these vaping products. So it takes a community to support an initiative and create the change, create the social culture around what does our community think about health. And as a business and as a leader in your community, you have that voice. You can support solutions in this example with smoking to address that belief system that is getting formed around smoking. So you could promote a policy, for example, that changes the view around nicotine use. Policies like a tobacco retail license, where you cap how many tobacco shops are actually in a community, and or where the colorful posters are or those vaping displays are located. In many corner markets, you'll see nicotine at eye level, next to chips and candy, right on the on the counter or behind the cash register. And that's where children see it, and it becomes normalized. In fact, I would venture to say that more children see nicotine products on a normal daily basis than they do a gallon of milk or fresh fruit when they go to checkout. So what does that say to our children as they're forming their choices and their behaviors moving forward? In the January 2021 Surgeon General report, it states that 80 to 90% of health outcomes are a result of conditions in a community. So basically, how we see our world shapes the choices we make. If we live in apartments where we don't see smoking, it doesn't become normalized. If we have parks that are safe and easy to access, then we may choose to be more engaged in the park and active. If we have healthy ads or no ads, that would be great, that influence us by the corporate money and giants that are selling their products. If we have healthy choices of healthy foods available, and it makes it easier for us to have that choice and make that choice to eat healthier foods. So I was having a conversation with a doctor, and she shared a story with me about one of her patients. And the patient was having a lot of symptoms and medical problems. And the next step was really about, getting on medication. And her patient really didn't want to try medication. So she's like, let's try changing my behaviors. And she decided, I'm going to walk to the grocery store. I'm going to start buying healthy things, making my meals at home, walking every day. And it really changed things around. For about 2 or 3 years, this patient didn't need any medications. All of her levels came back down to normal. And then about year 4, something started to change in her medical symptoms and the tests coming back. And the doctor asked her, well, what's going on? You were doing so well. And she said, I think it's that I had to move. And I moved to a neighborhood that I wasn't close to my grocery store anymore. And I don't feel safe walking around. And there's a lot of fast food, so it's just easier to grab and go. And I thought, wow, this is a really interesting observation. And I think it really speaks to all of us that, if the healthy choice isn't the easy choice, like in our neighborhood or where we are, then we often find ourselves doing just what's easiest. So how do we shape our communities to make the healthy option the easy option for us? Let me go next slide. Okay, but you've heard me talking about this, but I don't want you to just hear it from me. Let's hear it from people in our own community.
Can a community be wealthy if it's not first healthy? Or do you need to first be healthy in order to be wealthy? Which comes first? Kind of reminds me of a story that a Karuk elder told me once about clean water and salamanders. Modern science indicates that the water has to be clean in order for salamanders to be present. The Karuk elder said it's the other way around, and you need salamanders because they are the cleaners of the water, and it's their job to keep the water clean.
Most people's main focus is downstream. It's pulling those people out of the water. But what's happening up the river? Why is this happening in the first place? And let's fix that problem so that it's not this giant problem down the stream.
Our region is honestly a diamond. There's things here that you cannot find or do anywhere else. But what makes that a place you want to go to, a place you want to stay or come back to, are the people.
The most important resource that a business has, it's their humans. It's the people that come and they give of their time and their talents and their energy.
If you're going to do an infrastructure project, how will this address some of the things that are part of our cultural challenges? Can you show us that this is going to lift somebody up out of poverty? Can you show us that this project somehow will address things like racial inequality? We would have thought years ago, well, those don't have anything to do with infrastructure, but they do. We're actually beginning with the people instead of with the project.
Why is this so important, this work of addressing the social determinants of health and economic development? From those early stages on, negative health impacts create these unequal starts to life and then further hold back those opportunities for healthy living and healthy growth.
It's all linked in such a way that when individuals are struggling, the companies they work for are going to struggle, as well as the industries that those companies are in, and then the region. It's all connected in such an important way. We need both health and wealth for either one of them to really be what the community needs them to be.
When people are healthy, when an economy is healthy, not only are businesses improving, but other areas are improving. When it's, let's come together, let's work together, let's figure this out, the wisdom is in the walls and the people around us. Like my dad has said many times through my life, problem's only an opportunity for success.
How does a community come together to define the environment of that community, to set up an environment where that healthy choice is easier?
We need to start working on preventing adverse childhood experiences in our community. Instead of a liquor store selling cigarettes at every corner, I'm going to have a yoga studio at every corner.
A lot of times when retailers make changes to take the vape and flavored vape and the cigarettes away from eye level for the teenagers and our big people ask for it, it's actually good business because you get a good reputation in the community.
How do we look at policy in the communities and make our communities more walkable and bikeable, make it easier for us to move?
They find a really clear correlation between a community's proximity to parks and neighborhood parks and playgrounds and the overall health of that community.
We want those healthy opportunities and those healthy places to go and parks and cool things to do.
If you look at the most prosperous communities, they are thriving with things to do in the outdoor environment. It's become really evident the value of parks and trails in increasing property value and making commercial businesses more viable.
To be able to make decisions that improve the well-being of not only us as individuals, but our communities as a whole.
Really tying together these economic pieces of access to address these social issues in a bigger way that creates lasting change. So every child gets to have healthy food, healthy air, safe water. And opening up these opportunities actually changes someone's physical health from the earliest years through the end of life.
If we just change that very ground floor foundation that we all step on every single day when we walk out the door, the idea should be I walk out my door and I say, I love this place, not open the door and say, it's still the same.
What we're creating, trying to deal with the downstream and intervening later, is creating a tremendous amount of energy for individuals, for our community together that we could have stopped with a lot more smarts upstream.
The community has no idea. I think they raised me. It's that mentality, and it's that type of pride living here, having those jobs, because you're caring about the people that raised you. It's having that whole family type dynamic as your government. They're part of your family.
We have so much innovation and creativity in our communities that are untapped to create economic vitality in a way that doesn't feed addiction, but creates recovery and opportunities.
What do you desire for your children, your grandchildren, your great-grandchildren? What world do you want them to grow up in? Those are the discussions that we need to have, and we need to do it together.
We can recreate our systems. We can find solutions that bring people together.
We're seeing community come together. We're seeing resilience, and that's what makes communities more healthy. That's what makes communities more great. When we can show children, look how we come together in times of crisis. Look how we stand together when we're hungry. Look how we stand together when our senior community needs something. The way that the community here really shows their greatness is through resilience and how strong we are for one another on the behalf of one another and how we show up for one another.
I love hearing our local community and their perspective on all of this. We have a voice and you have influence, and together we can create lasting change. If I can change the slide. All right, so how do we create this lasting change? Well, here are just a few tips. I have a QR code on there. If you hold up your cell phone and you take a picture, it'll take you to our website that has some of these tips on there for you. But, you know, you could submit a letter of support on an issue that you care about. You could spread the information by sharing this training or asking me to come speak to your employees or any clubs like chambers, rotaries that you're part of to spread the word. You could show up at a public meeting where they talk and discuss about the community planning goals, such as housing and planning and safety and parks and recreation. And you can support this by encouraging health policies to be used and addressed in all of those visions and goals of those planning meetings. On our website, we even have community snapshots, health snapshots of the 4 different counties that we cover. And these snapshots really are to help you kind of understand where the health is in your community and where you might want to engage and try to change. And this one I put was Del Norte County because that's actually where I am today, is up here in Crescent City. And you'll see that unfortunately out of the 58 California counties, we rank 50, 58, 52nd, 53rd in several or most, unfortunately, of the county health rankings on overall health factors, health behaviors, social economic factors. So we have a snapshot of each of the 4 counties. If you want, I think Joanne can put the link of that website page, our website, in there for you to get information about your own counties. And with that, I just want to say thank you for taking the time out of your day to come to this presentation. And I hope that you feel a little more motivated to take an active role in our community's health and that you see that connection of how that is actually affects our economic success. Next up is Tina Yuen, our senior planner from ChangeLab Solutions, who will dive a little deeper on actual health policies in communities that have been able to help change those communities. And she'll give us some more examples. So I will stop sharing and hand it over to Tina.
Great. Can everyone hear me okay? Fantastic. Okay. Slide. Well, good afternoon, everyone. I'm really excited to be here, and thank you to Amber and Joanne for having me here. So this presentation is all about why community health and planning matters to businesses and how to create lasting change. So I'm Tina Yuen. I'm a senior planner, as was mentioned, from an organization called ChangeLab Solutions, and I've been working at the intersection of public health and planning for over a decade now, and I work on issues related to transportation planning, housing, environmental health, and sustainability. And I also work to improve how communities make decisions and plan their communities in order to foster healthier, equitable, more sustainable communities. And just a little bit about our organization, ChangeLab Solutions. We are a national nonprofit headquartered in Oakland, California. Our mission is to help advance equitable laws and policies to ensure health for all. And our solutions address all aspects of a just, vital, and thriving community. And so just, what I wanted to go over with you all today in the next few minutes is a few things. I think the purpose of this presentation is to really discuss, leading from where Amber started, is why pursue healthy communities and why it's a worthwhile goal and pursuit for businesses and economic leaders here in the region, and to highlight policy initiatives and solutions that do just that. And so I wanted to talk to you about the elements of a healthy community. What do we mean when we talk about what's in a healthy community, the goal of businesses and economic leaders, how you all can get involved, and then go and dive into some specific policy examples to go over with you all. So this is a diagram. It's a very busy diagram of the elements of a healthy community, and I wanted to take a moment and sort of walk through all of these different elements. And I think it's important here to note that although worker health and wellness is really important, the focus of our discussion today is really at the community health level. That is it's beyond just employee health or worker health, that we're really talking about at the broader level of the community, and just really wanting to focus there for a minute. And this diagram depicts all the interconnected elements that make up a healthy community, what I call the ingredients for what's needed to thrive and be healthy. The community, as you know, is where we live, it's where we play, it's where we work, it's where we school, it's where we worship together. It's all the various systems and institutions and places that work together in harmony to keep a community functioning and healthy. So the different elements here, are the economic systems, the government legal systems, family support systems, cultural norms and community systems, and natural and ecological systems. The next level down is really about the place and the space within communities. So that's schools, that's work, that's where you live, it's your house, it's retail spaces, it's social, civic, and public spaces, also healthcare as well. And the next level down is about food, utilities, transportation. Again, all the various ingredients or elements of a healthy community, all working together to ensure that we are healthy and have what we need to be thriving and successful. But you may be asking yourself, why focus on the community health? Why is this important in terms of where we should be focusing our efforts? Well, when you look at the research and you look at what exactly is contributing to our health, studies are actually showing that healthcare is only responsible for about 20% of our healthcare outcomes. About half is determined by two aspects of our community, or social determinants of health, our social and economic systems, as well as our physical environments that together shape our behaviors, such as whether we smoke, whether we eat nutritious foods, or whether we engage in physical activity that drive our health outcomes. It's what Amber said. Basically, what's in our environment shapes us, or put it another way, we shape our communities, which then in turn shape us. And everyday experiences are everything. We only see our doctor maybe once a year, maybe twice a year if you're sick. The other 364 days a year, 24/7, we spend out in our community. So it's really our daily, day-to-day experiences that truly determine whether we're happy, whether we are healthy or not. So just going over the role of businesses and why this really matters for businesses. Again, this really affects businesses' bottom line. As Amber said, we're all interconnected here. What happens in the community impacts businesses, overhead costs, etc. And we are, and community health is also dependent on a prosperous and strong economy. And I wanted to depict this in the diagram here, the system of the relationship between our health as well as our economy. And we all know that there are, many challenges here in the region that affect our health as well as our economic well-being. These are headlines ripped from the local news outlets here in the Redwood Coast region. We all know that the cost of living in Northern California is extremely expensive, and that's largely because housing is unaffordable, all of which impacts economic growth and opportunity within the region. Employers in Mendocino County are having a hard time recruiting because of this. In Humboldt County, more than half of the county residents don't make enough to afford a home in the county. I won't go over this because Amber spent a lot of time, but again, tobacco use increased the cost of doing business, and obviously it's harmful to our health. So what can businesses and economic leaders do? Businesses have a large influence over the local politics and policy decisions that shape our communities, and that makes sense, right? Businesses employ community members, pay taxes, provide needed services and amenities that community members need, and help build the economy upon which we all depend. And businesses and economic leaders play a very important role in our community, and can also play a big role in fostering healthier communities as well. So how to get involved? I think, one of the big opportunities here we wanted to highlight is collaborating or partnering with your local health department partners within within the county or the region. We need everyone to work together to tackle our biggest challenges. We need to build partnerships and collaborations across silos, across sectors, to make the change in the community that we really want to see. Cross-community collaboration can improve community efficiencies and generate win-win situations. Collaborations can generate efficiencies in resource sharing and decision-making, and help ensure situations in which everyone benefits, not just one person or one sector, but everyone benefits. And as I, depicted earlier in the healthy communities diagram, really every aspect of the community really impacts our health and well-being. We've learned that so much of the community contributes to the health and well-being of our neighbors. So working collaboratively can improve community health and well-being, which in turn improves our economic prosperity. So the roles that businesses and economic leaders can take in these various public health initiatives, there are a few here that I wanted to highlight. I think one, being a connector, identifying partners and other entities that can help to support or champion a cause. Businesses can advocate for specific change or policy or decision and outcome within local government. Businesses and economic leaders can also be an amplifier by amplifying the voice of others, by writing, speaking, blogging, or interviewing on particular topics in the media. And businesses and economic leaders can also serve as an expert by providing subject matter expertise or experience with a particular issue or policy. So those are just some of the ways that businesses and economic leaders can actually show up and get involved. I also just quickly wanted to highlight some planning opportunities for you all to think about getting involved in. There's lots of opportunities to get involved in, specifically planning opportunities. A few jurisdictions within your region are in the process of updating their general plans. And general plans are long-range plans, or what we can call blueprints for communities that are usually updated once every 15 to 20 years, that set the course of a community's growth and development. So these are really important planning documents that really set the long-term strategic vision. Several jurisdictions are also updating their housing elements, which are also really important long-term documents that set out actions and policies related to and increasing housing, affordable housing. And you can check out NorCal for Health's website for more information on how to get involved. So I did want to go over specific policy solutions and initiatives. And I first wanted to go over what is policy change. We wanted to just make sure we were clear here on what this is. And policy change is about creating or altering a formal written statement of a government, business, or nonprofit that results in a new organizational position, decision, action, rule, or regulation. Policies codify in writing and obligates organizations to act or respond in a particular way for the benefit of the community, customers, or other stakeholders. And these are written documents that can be used to guide implementation and also hold certain entities accountable to what is decided. So I wanted to highlight an example of a policy change that advances healthy communities in regards to tobacco control. The goal here is to limit and control access to tobacco products, which we know are harmful, particularly for youth or young people. So the policy strategy to lift up is the tobacco retailer licensing policy, which is a policy that requires all stores that sell tobacco to obtain a special license for the privilege of selling those products to consumers. The government can impose specific performance standards and requirements as a condition of maintaining the license. And often these policies are used to limit, restrict, or control access to tobacco products. This is good for health because obviously this can reduce smoking rates, which decrease illnesses and deaths. It's good for businesses because it can lead to improved worker health, productivity, and lower costs for businesses. I want to highlight an example here within Northern California. This comes from Hillsborough City and Sonoma. The local leaders there really lifted up youth smoking as a priority, and lifted up TRL, or tobacco retail licensing, as a viable way to monitor and limit tobacco sales. And the city council there approved the first ordinance in the county back in 2014, and some of the provisions there prohibit the sale of tobacco in pharmacies, prevent youth access, and also the age of purchase from 18 to 21. Sort of continuing on in the healthy retail environment, there are other ways to improve and restrict access to tobacco products by limiting tobacco placement and advertising, especially to youth at the point of sale. So here's what we know. 90% of smokers start smoking before they are 18. So the age, young people are it's really important that they don't start smoking. Access and exposure to marketing more than doubles the odds that young people will try tobacco, and youth are 3 times more sensitive to tobacco ads than adults. This is really good. This type of limiting of tobacco product placement and advertising is good for health because it can limit youth access to tobacco products and reduce experimental smoking among young people. It's good for business because youth eventually will grow up and become part of the workforce. Decreased smoking will lead to health and increased productivity and reduced costs. I do want to highlight there's an example of such an ordinance in San Diego. This ordinance establishes restrictions on the location of tobacco products and e-cigarettes and advertising inside stores. Moving on, I wanted to talk about walkable and bikeable communities. The goal here is to foster greater walking and biking, which can lead to greater physical activity. One policy strategy to achieve this is through complete streets policies, which is an approach to street design whereby streets are planned, designed, built, and maintained to serve all people who use the streets. The policy provides a blueprint that can guide implementation. There are multiple health and economic benefits here to note. It's good for community health because we're increasing physical activity, which decreases obesity and related chronic diseases like diabetes. It's actually really good for businesses in the local economy. There have been multiple studies that show that people who visit shopping districts by bicycle spend more money on a weekly basis than those who visit by car. That construction projects that build biking and walking infrastructure also create more jobs than do traditional road projects. I wanted to highlight a couple of examples of this. One comes from the Outer Banks of North Carolina. They spent over $6 million over 10 years to build bicycle infrastructure there in the Outer Banks. If you've ever been to the Outer Banks, it's very flat, it's very bikeable, it's beautiful, it's on the water, it's a great place. This is a tourist destination, so lots of people come to the Outer Banks in order to bike around. This has resulted in $60 million annually and with revenue from nearly 700,000 visiting bicyclists a year. So this is a big economic driver in the region. Another example comes from Boulder, Colorado. Boulder, Colorado has been certified as one of only 5 platinum bicycle-friendly communities in the country. The city ranks number 2 in the top 25 cities with the highest share of bicycle commuters. The city hosts over 159 miles of dedicated bikeways. And all of this bicycle infrastructure and activity has led to significant economic activity, over $52 million in economic activity and over 330 jobs created to date. So that's a very significant driver there in terms of economic benefit. I did want to move on and talk about high-speed internet. The goal here is to increase high-speed internet. With so much of our lives spent online, here we are virtually. High-speed internet is a real critical utility. The Federal Communications Commission estimates that 21 million Americans still lack broadband access. Some places as high as 162 million. The gaps in rural areas particularly are pretty stark. In 2017, a full 30% of rural Americans, or 19 million people, and 21% of farms lacked broadband access. So that's significant. So the policy strategy here is to expand broadband access, especially in underserved areas like rural areas here in the region. Communities without reliable high-speed internet services cite a growing gap between resources and opportunities available to residents and communities that have robust internet service. And recognizing the importance of broadband service has really galvanized a lot of policymakers in states across the country to try and close this gap. And most have really tried to expand this as an issue. And it's a huge area of interest. The federal government has allocated over $7 billion during the pandemic to expand broadband access. There's plans in the infrastructure bill, if you're following that, and in ARPA that really dedicate investments in expanding broadband access. This has huge implications for health and economic well-being. I could spend probably all day going over that. I will probably not go into that, but just to let you know, like, this is a huge issue and area of interest. I did want to highlight that there is the Broadband Forward program in Wisconsin that is trying to expand access primarily in rural communities in the state. And just want to highlight that in rural Bayfield County, the arrival of broadband meant that fewer people are actually leaving the rural area for urban areas. So they're staying put rather than going elsewhere to seek employment. And I did want to close out. I'm sort of circling back to affordable housing. Affordable housing is a big topic, not just only within here in the region, but across the country. Health systems or hospitals are investing in affordable housing as an avenue to significantly improve community health. As many of you know, healthcare systems often have large amounts of resources and community benefits at their disposal that can and should be reinvested back into the community, into the communities that they serve. And these investments can help improve safe and healthy housing for people who might otherwise go homeless or live in substandard conditions, both of which lead to health problems. Over the long term, health systems can actually expect to see cost savings related to improved health in their communities. So it's not just good for community health, but it's also good for the bottom line of these varied healthcare systems. I did want to highlight an example from Baltimore. This is the Bon Secours health system. The residents in the local community there have higher rates of chronic diseases. The hospital recognized the need that they needed to get involved in community development, actually began building affordable housing within the neighborhoods. And currently, and that was back in the early 90s, and currently Bon Secours owns and operates more than 720 affordable housing units there in Baltimore. And so with that, I will end my presentation. I know I just covered a ton of material. I think each of these examples would have been 2 hours worth of discussion and questions. So I know I skipped over a lot, but I'm happy to answer questions. Thank you.
That's great. Thank you, Tina. I just am looking at the chat here. There's been a little bit of conversation going on around who to approach in smaller communities that don't necessarily, little townships that are not incorporated, and to get the community involved in that. I'm just looking at our time. We've only got about 8 minutes left before the next session. And so if anybody has a specific question for either Tina or Amber, now's the time to ask it. I noticed that Megan made a comment about when you were chatting about broadband internet, and she said, you know, the more time we spend online, the less we occupy our natural areas, bicycling and connecting with place, which is detrimental to our health. Yes, there's economic benefits, but little benefit to our health. And I'm just wondering if you want to make the connection there, or talk a bit about that, either Amber or...
Yeah, Amber, do you want to start off, or do you want me to jump in first?
I was typing in the chat. You can start off, so I have finished my little chat here. I'm sorry.
Yeah, no, of course. You know, I do think it is a balance, and I do think that it's not all or none. I do think that there's moderation. I agree with you that spending 100% of your time online is not a healthy thing, but I do think that so much of our lives is online. It's very critical that people have access to broadband, high-speed internet. I think a lot of data sort of backs that up, not only for our own sort of like health and well-being, but also economically. So much is happening online. So it is a balance. I don't think it's it's not to say that broadband internet and being online is more important than other things, but it is an important thing that we have access to.
Amber, did you want to?
Yeah, so I'm sorry, I was trying to put our survey link back in and I can't paste it in there. And so anyway, so I might not have heard all of it, but if it's in response to broadband and it not necessarily having a direct health relation, it's such a complicated topic, right? Everything is really intertwined. And so what we may think is shopping online isn't healthy, right? We're not getting out and about, but having broadband and access to mental health services where we couldn't make an appointment here locally, but now have access to healthcare, and have access to connection and access to education. Those are other aspects of health and changing the way we think about things. So a lot of this, 80% of the choices that we make or the decisions on health are behaviors and value systems that we have molded within ourselves, right? So although initially I can see that that response of not going outdoors as much, it also does increase our health in other areas. So with everything, it's always way more complicated than we think.
And it is all connected, and I'm seeing some good responses coming in the chat. I do want to honor everybody's time because I know the final sessions will be opening in just a few minutes. So if you want to reach out to us, of course, come to our website, norcalforhealth.org. Please fill out our survey. You're going to receive a $30 New York Times best-selling book titled Upstream: The Quest to Solve Problems Before They Happen. There's also going to be, I'll put a link in the chat for the summit, for the economic summit survey as well that they have put out. So each of these shouldn't take more than 3-4 minutes each. So we appreciate your help with that. And I just want to thank again both Amber and Tina for coming and giving your presentations today. It really opens up the conversation. And again, we hope you can learn more and get involved at your local level. So thank you all. And I think it's time to head back to the main session. And thanks again. So let me get the event. So I wasn't able to, there we go. Let me do it this way. Okay. To directly paste.
Yeah, I couldn't paste it.
Yeah, I couldn't paste it directly from our flow. So I just put it in the chat. If you do get a chance to fill out the surveys, you know that how they can help not only this current event, but future events. So we appreciate you being able to do that. All right. Okay. So not sure how everybody.
I don't know how we close other than I guess we just leave, right?
I think we just leave and folks will leave as they can. So well done, you guys. Great job.
Thank you for having me. This was fun.
Yeah. Look forward to seeing what unfolds from all of this when we see the recording and the chat and all of that. So have a great afternoon.
Thank you.
Great. Thanks, Amber. Thanks, Joanne. Talk to you all soon.